Plan Act beginning on May 1st, no one in America can pay more than 8.5% of their 2021 income for their own health insurance. The federal government will be subsidizing the cost through December of 2022. Craig Gusson of Auerbach and Gusson Insurance and Financial Services joins us now to discuss more about the subsidized health care. Good morning, Craig. Good to see you.
Good morning, Lauren. How are you guys doing?
Well, and even better now with a look at that sunrise behind you. My goodness.
Thank you. I figured I'd give you, last time was Muhammad Ali. I figured today I'd give you some sunshine.
There you go. Well, this is something that's expected to benefit about 3 million Californians. Yeah. And even though we're saying it starts May 1st, you can actually sign up starting April 12th. So tell us exactly who should be paying attention to this.
Okay. So under the American Rescue Act that was passed by Congress, signed by the president, you can't pay more than 8.5% of your income. So if you think of somebody making, for example, I ran some numbers, if you're making $3,000 a month, you can only pay $255 a month for health insurance. If you're making $5,000 a month, that's only $425, and that doesn't make a difference if you're single, married, with kids. So a lot of people are going to save money. I ran numbers, and Cover California said that people would save at least $500 a month. My numbers were closer to probably minimum of $500. But if you're a family of four and you're maybe in your 40s, 50s, 60s, you could save over $12,000 a year. So I'm sorry, $500 a year to $12,000 a year. So there's some big savings. Starts May 1st. You can sign up as of April 12th. April 5th is Cover California's website will be up and running. But the best thing to know is that it's only if you have your own health insurance. If you have insurance through your employer, this won't affect you at all because your employer's health insurance, you pay with pre-tax dollars. Employer pays part of it. It's only for somebody who has their own health insurance. If you're on Cover California and you like your plan, you don't have to do anything. As of May 1st, you're going to notice that your cost will go down to what is 8.5% of your income. Some of the other things that you're going to find is that's really interesting that I haven't seen in a while. If you have a plan, let's say with HealthNet, Kaiser, Sharp, Blue Shield, and you go from a non-Cover California plan to a Cover California plan, any medical expenses you incur this year will go with your new plan. If you go from Kaiser to Sharp, everything starts all over. But that's a good benefit for a lot of people who may incur medical expenses this year and don't want to start all over. That's one of the big things. And it's an open enrollment. Anybody in California or across the country can now buy health insurance. So if you missed a deadline to get it or there's some issues running, you can do it. If you collected unemployment for at least 1 week this year, you could possibly get a plan that's really, really good for like $1 a month. And I'm talking $5 copays, $8 for a specialist, very low deductible, very low max out of pocket. Some big changes that are happening.
That's pretty impressive that you can, if you collected unemployment in 2021, which a lot of people have, as we know, you can get a health insurance plan for $1 a month. A lot of people have trouble navigating these things, Craig, because there's so many details that come when there's changes like this. So it has to be through Covered California, but you can go to consultants like yourself to figure out the best plan and the most cost savings, right?
Yeah, we've been working. I probably have been averaging 2 or 3 webinars a week. I have another 2 or 3 this week, just learning all the different variances, such as if you're on COBRA, and depending on how you went on COBRA, you may end up having your employer pay for all your health insurance for the next couple months. There's some very interesting things going on with this that will save a lot of people money. Understand, though, you can only buy this through Covered California. That's where you're getting the federal subsidy. So it's really confusing. Well, how much money am I going to make this year? Nobody knows. Lauren, you and Paul have no idea what you're going to make this year because it depends on if you take some time off or you're going to work more. So we sit there and say, okay, let's talk about that. If you estimate low, you're going to get a higher tax refund in a year from now. If you estimate high, you're going to get a lower tax refund and maybe you're going to owe a little money. But it's a great time to sign up, save some money. let's say you have a plan, you're saying, you know what, I picked this really, really cheap plan because that's all I wanted to spend. You can now get a better plan and probably pay less money and still have great coverage. And I think that's a big key to this is everybody can get better coverage. I've had employers ask me, if I drop my group health insurance, will this benefit everybody? Not really, just because of the employer contributions and the more choice of plans. So this is really for somebody who is not getting health insurance through their job. And that's a lot of money. I mean, I have clients paying a couple grand a month.
Yeah.
And, my numbers said they're going to pay maybe under $700 a month.
So a lot of potential savings here, Craig, as always. I mean, there's just so much information to go through, but we want to let everybody know you can go to auerbachandgusson.com. And certainly, Craig, you're just a wealth of information in this area. But thank you for coming on and letting everybody know. It's good to see you.
Hey, great to see you guys. Nothing I love doing more at 6:45 in the morning, hanging out with you guys.
Thanks, Craig. Have a great day.